Hello, my name is Doreen Tembo. I work for the UK National Institute for Health and Care Research, also called the NIHR. Welcome to this podcast series, which spotlights on community engagement and involvement, really focusing on improving global health research and outcomes through engaging with local communities. Welcome to part one of this podcast, where we explore what mechanisms and structures best support meaningful CEI across multiple countries. And I'm delighted to be joined by members of the Empowering People with Cutaneous Leishmaniasis intervention programs to improve the patient journey and reduce stigma via community engagement. The short project title for this is Eclipse, and this research study is funded by the NIHR Research and Innovation for Global Health Transformation, which we also call the RIGHT program. Today, I would like to extend a very warm welcome to the co-lead investigator, Dr. Helen Price, who's a professor of parasitology at Keele University here in the UK, and Delini Agmapodi, who's a professor in social epidemiology at the Department of Community Medicine in the Faculty of Medicine and Allied Sciences in Rajarata University of Sri Lanka, and also to Professor Clarice Mota from Brazil, who is an associate professor at the Instituto de Saúde Colectiva, UNFBA in Brazil. And I would also like to welcome Dr. Kelamwork Tafere Reda, Associate Professor of Anthropology, College of Social Sciences and Languages, Department of Sociology at Mekelle University in Ethiopia. So a very warm welcome to you all, and thank you for joining us and making this time as well. I'd like us all to get to know each other a little better. So I'd like to ask you a question, starting with Helen, perhaps. Could you describe or paint a picture for our listeners focusing on your country?
Okay, so I live in the United Kingdom, in England, in a small village called Keele. The United Kingdom, it's an island in the Atlantic Ocean. We're known for talking about the weather. We have very variable weather. We can have all four seasons in one day. It's quite green because it rains a lot. I don't know what else.
Being based in the UK myself, I think that's a very accurate description of the UK, especially the weather. It's supposed to be summer, and I was just sharing with the guests how it is cold. I have got my cardigan on, and it is rather dark and dreary. So I'm pretty sure that the rest of our guests are going to paint a much brighter, hopefully, picture of their country. But nevertheless, as Helen says, a very beautiful, if unpredictable, weather-wise country. So if we could move on to Clarice.
Hi, Doreen. That's very good to paint a picture of Brazil, but it's a very hard task because Brazil is a very large country and diverse, not only in terms of culture, but in terms of weather and environment as well. So I live in the state of Bahia, which is in the northeast, and now it's raining a lot because we are in the winter. But if I would paint a picture of that part of Brazil, I would paint a bright sunny day at the beach with a clear blue sky, and I think that would be it.
I am very, very envious, Clarice. I think both myself and quite a lot of our listeners will be wanting to head to Brazil right now. Thank you very much. Two very contrasting images there. And Delini, how would you describe Sri Lanka?
Thanks, Doreen. So Sri Lanka is a very small island compared to what Brazil, as Clarice said. So it's situated just down south to India, and it is known as the Pearl of the Indian Ocean because it's a very beautiful country. So we have beautiful coasts around because it's an island, and in the middle of the country there is the hill town, very beautiful with plains and a very cool climate. It's a tropical country again, and a lot of cultural groups live here, ethnicities, Sinhala, Tamil, Moor, and so on. We live in peace at the moment. So it's a really beautiful country. Was affected by COVID, now going on to a financial crisis.
Yes.
But anyway, people are modest and having a agricultural-based economy mostly. Yeah, so that's about Sri Lanka.
All right. So let's hear a bit as well about Ethiopia, but some contrasts so far and similarities in all of us seeing the beauty despite the different contexts and cultures that we're from. So let's hear a bit about Ethiopia from Kelemark.
Thank you very much. First of all, Ethiopia is a vast country. It is probably 2.5 times the size of Germany. I say Germany because I did my PhD in Germany. Ethiopia has a population of over 100 million, which makes it the second largest in sub-Saharan Africa. It's a very diverse country in terms of ethnicity, culture, and language. We have over 80 ethnic groups presently in Ethiopia. And the country is also rich in natural resources. For example, Ethiopia is the source of the Blue Nile River, which is the longest in Africa. That is about Ethiopia in brief.
So thank you very much. So it's really important then that we bear these scenarios in our mind as we discuss things going forward, because community engagement and involvement is quite different, I think, depending on the context and the culture and the systems and the politics. And Talini mentioned the economic situation as well that you're operating in. So perhaps I can go back to Helen. Could you tell us a bit more about the research?
Eclipse is a 4U program that was awarded funding by NIHR. Eclipse stands for Empowering People with Cutaneous Leishmaniasis, intervention program to improve patient journey and reduce stigma via community education. So very long title. I've worked on leishmaniasis for many years, but as a parasitologist, I work on the parasite rather than the people that it affects. So this was a new venture for me. The other co-lead of the project is Professor Lisa Dicamitis, who is a medical anthropologist. So, and we have a large team with lots of different disciplines represented. So we have social scientists, parasitologists, dermatologists, psychologists, sociologists, clinicians. So we have a really large team with lots of different types of expertise. And we're working around this disease, leishmaniasis. So this is a disease that results from infection with a tiny parasite, and it causes disfiguring skin lesions. And we know a lot about the biomedical aspects of the disease, but very little is known about the wider effects. So what impacts does it have on the people who have this condition? Are they stigmatized? Does it have effects on their ability to live in communities? Are they discriminated? And we don't know very much about awareness of the disease in communities that are affected. So the broad aim of the Eclipse program is to look at the challenges that people have who have this condition, and then to start to address those challenges by designing and implementing some interventions. So this could include training for healthcare workers, and also to raise awareness of the disease, how it is spread in communities.
That's such an important project, isn't it? And it's very clear from how you've described it why it has such an important community engagement and involvement component. And great to hear as well about how interdisciplinary it is in bringing so many different people together. Is the condition prevalent across the world? Because there's so many countries in different regions involved in the project.
Yes, it's found in about 90 countries worldwide. It's very closely associated with extreme poverty, and it tends to be found in marginalized populations. So it's a really neglected disease. Not many people are aware of it, but there are about 2 million new cases of this a year. So it's a big problem.
No, it is. And it's great that there's this program of work tackling it just to ensure that nobody's left behind, as you say, if it's a neglected research area and condition. So thank you so much for I think, educating all of us in this condition. So I would like to go to the rest of the team to find out how they got involved in the work. Perhaps we can start with Clarice in Brazil.
Yeah, for me, it is very important to be part of Eclipse team. I'm an anthropologist, but I work in the Institute of Public Health, and I have never worked with leishmaniasis before. It's my first time. I used to work with sickle cell disease for the past 10 years. So it's an opportunity of learning, even though they are both neglected conditions. So to work with population that are in poverty situations is something that is very important due to this neglection that Helen mentioned. And for me, it's an opportunity also to work with rural communities. Here in Brazil, I had never worked before with communities that are in rural areas of Bahia. So that's really something that I'm learning many things in terms of cultural diversity and way of living. So it's wonderful.
Excellent. No, thank you for sharing that, Clarice. And Talini?
Yeah, Doreen. So I am a public health physician practicing field work in the community. So attached to the Department of Community Medicine, we were doing a lot of field activities, specifically in maternal health. So when the country lead got the project, I was very happy to join the project because specifically, although we were doing public health, CEI was a new approach to us, and I was very willing to practice and get experienced to engage with communities. So I joined the project as the qualitative expert, and I really do enjoy the work doing CEI.
Thank you. And of course, Talini's mentioning CEI, which a lot of our listeners will be aware of. That is the abbreviation, of course, for community engagement and involvement. Thank you for sharing that. And perhaps we can hear from the Ethiopian perspective.
Yeah, so I am a social anthropologist by profession, and I've had some experiences in qualitative research, ethnographic work, participatory approach, even before the Eclipse project came into our place. I mean, there was vacancy announcement for which I had to apply. A friend of mine actually informed me about this position, so I had to apply. And that's how I got into the project, and I've enjoyed being part of the project. And by the way, this is one of the few instances where I worked with public health professionals. So it's a learning experience for me.
Thank you. So now let's find out a bit more about how CEI is embedded in the research program. So perhaps we could go back to Helen.
So CEI is incredibly important for the project. We've involved the communities at all levels of the work. So when we first designed the project. We asked for information and advice from local communities, and we have 2 different types of community groups who've advised us all the way through. So we have community groups at village level, and also we have policy groups at regional level.
Right.
So we've asked the community groups for advice on how to recruit people for the study, and also to help us to design methods and documents, and really everything that we are doing in the project. We've asked communities to have input before we do the work. So we've really co-produced the project with the communities.
That's excellent. So they've been actively involved in steering and guiding the work that you're doing, which is excellent.
Yes, and working with 3 very different countries, we thought it would not work to have just one approach, because something that might be acceptable and in context in Brazil might not work or might not be feasible to do in Ethiopia, for example. So we have to design the work around the communities rather than just going in and asking everyone the same questions. It really wouldn't work.
That's true. So the importance there of respecting the local culture and how things work for each of the countries that you're working in.
Yes.
I think that's a really key point. Thank you, Helen, for sharing that. And perhaps I can now move to Leni to tell us a bit more about how the community engagement approach that Helen described has benefited the research in your country.
Yeah, exactly as Helen mentioned. So as I mentioned earlier, this was the first study for us, the faculty and the department, to have this specific approach, the CEI, community engagement. So from the beginning, what we saw was, it was bolded in our heads that we have to work with the community and go by the community. So from the start itself, we started work from the villages, communities. And from the beginning itself, from the designing and beginning itself, we, all the team, began understanding the context. And we were able to adapt more freely to the context because of this approach. Rather than, say, in other medical or public health research, we would design everything and go to the community and implement things. So it was quite different. So we were observing first the people and then designing with them together. And it helps us in every stage of the study. First, there was this ethnographic components where the ethnographers went to the communities, stayed there. So the community members helped them to find places to stay. They helped them to see everything in the villages. So they were very helpful, and we were facilitated a lot because of the approach. And CEI made the scientific studies more culturally sensitive, I would say. So what we gained, the conclusions, observations, they had this cultural touch all the time, rather than medical people doing a discussion and coming into conclusions. So that was a great benefit for the research. And it enabled us to respect the voice of people in the villages. And also because we were with the people, communities, we were able to identify all sorts of groups in the villages or communities. So it was a huge change compared to other public health research without using CEI.
That's fascinating. So really showcasing the importance, would you say, of adapting things for the local community so that it's more applicable and adoptable in the long run?
Yeah, that's right.
Okay. No, that's a really key point as well, I think. And Clarice, how did the CEI approach benefit the research in Brazil?
That is very interesting what Telini said, because it's similar in Brazil. The community, they were not used to this type of approach, because usually public health researchers come with everything already planned, and they only apply to the communities. And this other way of working in terms of participatory methodologies, in terms of including the community in planning together with them the research steps that are going to be taken, this is very empowering for the community, because we don't want a research that in the end nothing's going to stay there anymore. So it's 4-year research. If we don't empower the community, after these 4 years, they will not know, they will not have the tools to continue these actions. So I think the community engagement approach is very empowering, not only to the community, but to us as universities. So we are learning to do things with the community instead of doing things for them. And this is very important, because usually these communities, they were silenced often. They did not have their voices heard in the process of researches. Mm-hmm. And now I think this is a big change, because they can discuss with us the best ways of approaching even the ethnography. So what is the best way of approaching certain communities? And we're talking about rural communities. They have cultural diversity there, sometimes very different from the manners of urban Brazil, like I live in an urban environment. So they have other ways of living that we need to engage and to respect, like Telini was saying. So I think the community engagement methodology can cover many things, like including the dialogue with the community leaders, but not only the leaders, because usually we only listen to the community leaders that are often leading historically there. Mm-hmm. We need, in this approach, we also need to listen to people that were historically silenced. Mm-hmm. and who do not have been encouraged to participate, and we need to encourage them to participate. So we have community groups that we discuss the development of the project, and these groups, that we have WhatsApp group and also present meetings with these groups in every community. We are working 4 communities here in Bahia, and we also need to include the dialogue with the stakeholders, because usually the stakeholders, they are not listened as well by researchers. And how can we influence decision making in health policies if we don't work together as well with stakeholders? So I think is this multiple voices, the multiple actors that are in the communities, and community leaders, the community members that are not in leadership but are also important, and also the stakeholders, because we need them to promote benefits for these populations. So we are working through the community advisement groups. We have 4 community advisement groups, and we have the meetings. We make methodologies in terms of stimulating their voices to be heard and stimulating more protagonisms, especially for women or for young people that are not participating as well. So these are mechanisms that we are developing with them, and I think this is a very important approach to be more used in public health researches.
That was fascinating. Thank you very much, Clarice. You mentioned so many points there around bringing in marginalized voices, empowering the community, making sure that whatever interventions or programs we have are sustainable post the research, and so much more. I just wanted to ask you, you mentioned protagonisms. Could you explain a bit more what you mean by that term?
Well, sometimes in community, you have power relations that usually certain people are more heard than others. So when we, for example, men are usually more empowered in the communities. Not all of them, but most of them. So when we are doing, for example, a meeting, we usually do in a circle. We sit in a circle and we allow everyone. Sometimes you see a woman or even young adults that usually don't participate. They are like left behind, and we invite them. No, please come to the circle. You need to talk as well. So when we recognize the importance of people, they feel more open to participate, and we can validate their voices as well, saying, well, what you're saying, it is important, because sometimes they do not have the scientific discourse, they do not have the scientific knowledge to talk about a health problem, but we can validate and say, well, in your words, in your way of saying, you do have knowledge, because you have knowledge from the experience you have around this condition. So it's another type of knowledge. It's not scientific knowledge, but it's local knowledge. Mm-hmm. And this is a way of stimulating more protagonisms in communities.
That's really important. So that the need to respect different types of knowledge there is so important. And again, that issue of bringing in those seldom heard voices and making sure they're included in the process. Thank you so much, Clarice. And perhaps we can explore what similarities or differences are experienced in the Ethiopian context. Kellymark?
Community engagement and involvement is first of all about putting people first. It is about participatory development, particularly in the health sector. We actually involve communities in decision-making at all levels, starting from planning to implementation, as well as monitoring and evaluation. I mean, we don't engage people just because it is fashionable to do so, but rather because we should try to create a conducive environment for inclusive development. So CEI also implies that there is shared responsibility and accountability. Usually in conventional research, local communities are perceived as passive recipients of our intervention, which is wrong. Rather, we should treat local people as development partners, because they have huge amount of resources to contribute to our project, I mean, to the success and sustainability of our project. One such resource is indigenous knowledge, or otherwise known as local knowledge. And so we need to positively interact with the people in the grassroots without having to involve in some kind of hierarchical relationships. So what we did in Ethiopia was to first establish community advisory groups in different villages with whom we worked very closely. We shared with them our plans, methodologies, and implementation modalities of the project. They also helped us to get their own perspectives and priorities. And honestly, CEI was quite a new thing for them, because previous projects adopted more of like a top-down approach, in which communities were treated as mere suppliers of information to researchers about their own local conditions. So CEI actually changed the trajectory of people's participation, so much so that they now feel more important and showed interest in the project. That's why they now wholeheartedly support the project. That is how we are dealing with the issue of CEI in the Ethiopian context.
Thank you all so much for your insights into how that has benefited the research, but really your comments have also demonstrated how it has benefited the communities that you work with. So next, would like to explore what mechanisms and structures best support meaningful community engagement and involvement across multiple countries. And I think we've touched on these aspects, but Helen, did you have insights into perhaps what works when you are in a project such as yours that's looking at multiple countries?
I think the main point really is that we can't have one approach that fits all countries. So we have to have respect for the differences and the similarities between different sites and different populations. And as Clarice said, to bring in all of the people in those communities and not just the ones who are loudest. So we need to bring in people who might not be heard normally, because their voices are as important as any others. So we have these two different types of groups. So we have the community advisory groups, which we said were at village level. And we also have groups called the communities of practice. So this was based loosely on the communities of practice that we have in the UK for medical research. And this brings together lots of stakeholders, policymakers, clinicians, academic members of staff, lots of different experts who can also be ambassadors for the project.
Mm. So really co-producing the research with multiple stakeholders and end users and influencers
Yes.
of the research.
Yes.
Thank you, Helen. I think that's really key. That brings us to the end of part one of this podcast, which has been exploring the mechanisms and structures which best support meaningful CEI across multiple countries. Thank you so much again for joining us, and enjoy the rest of your day.